Hi, everybody. Here's a short lecture about Section 4 from our white paper in Caring for Caregivers. And although we've talked about it in other classes, I just want to reiterate the importance of caregivers in the field of arts and health and how we might be of service to them. So, again, caregivers are people who care for others. And this includes professionals, paraprofessionals, and, excuse my duplicate, and informal folks. And it really makes up the majority of the population. At some point, we're all going to be caregivers. When we talk about professionals, that's the clinical staff of physicians, nurses, therapists, CNAs, psychologists, social workers, etc., trained to provide specific um, care and specialization to individuals. And then the paraprofessionals, and I guess in this category is where I would put um, the home health aides, the CNAs or certified nursing assistants, um, with a sort of a lesser degree of education and specialization, but still very much the front line for interacting and supporting those in vulnerable health. And then the informal caregivers would be the family and friends um, who lend their time and their heart and their resources to people in need. And all of this can take care or take place in healthcare facilities, community based organizations, for example, like a senior center or uh, a youth program, as well as in private homes. And this section brings to attention the urgent need for art-based care for caregiver programs, um, which are starting to come about in American communities, but there's a lot of room for growth. And what um, the National Organization for Arts and Health, and for some of us who are practitioners, are very excited about in terms of advocating for arts and health programs is because that um, it's extremely cost effective. It aids in employee retention and reduces one of the most common uh, conditions among caregivers, which is compassion fatigue. Cost effective in that the choice of providing arts programming to support wellness compared to replacing and retraining um, a healthcare provider uh, is really no comparison. I believe that the current statistic is somewhere around $60,000 every time a professional is replaced, and so um, the art seems like a really reasonable measure that could actually go in any facility. Compassion fatigue, again, is essentially burnout as a result of this work. So, deep emotional, physical, and spiritual exhaustion among caregivers with feelings of reduced competence and loss of compassion. There's a certain numbness that can come from this deep fatigue. Also, lower productivity, high turnover, adverse patient events. So sometimes people's safety is compromised because of that condition, the compassion fatigue. Job related errors increase, poor service, or low patient satisfaction ratings. All of these are very important to healthcare administrators. And so um, it might not be as overt as somebody who is coming into the emergency room and is treated there, and the needs of the staff focusing in, but as a result of the workplace culture and the stress that's inherent, no matter what department, um, compassion fatigue is possible in all of those areas. So, recommendation for program development, um, arts experiences. So, the participatory arts and health experiences, painting projects, journaling, book clubs, dance, movement sessions, staff orchestras, choirs, all of those were, that kind of programming was lifted up in this reading. And it's nice to hear some of you speak specifically about programs that inspire you. These are not new concepts. I'm starting to hear them among you in class, which is very gratifying. And then art-based caregiver programs. Um, One of the things that gets people into the rooms are these continuing ed credits, which are typically required for many of you in your future professions, so that you continue to um, learn the most updated techniques and equipment. And so offering continuing ed credits, which are required, um, it can get people into the doors for retreats, professional development. You really can add art to any of these um, events. So there are specific examples that you will have read, and please note that nurses are one of the great areas of focus, um, because the retention of nurses is extremely important. But that's true of much of the hospital staff, and certainly with family caregivers, the need to tend to their wellness and just reminding people. It's one of the great things about arts programming. Not only can they have the experience, but to get into their body and into their memory the positive experiences of making and participating, um, increases the likelihood that they would do that for themselves, away from a classroom setting, or an arts and health setting, and on their own, which is one of the ways that we increase our resilience, is by learning things to care for ourselves. So, art-based wellness programs for family caregivers, third-party payment to provide incentive to program development, implementation, and evaluation. That was a suggestion at the end of, or a recommendation at the end of this white paper. Third-party payment, so that administration was inspired to develop and offer, and then also evaluate the success of these programs. As you know, it's an emerging field, and so I think these recommendations are helpful because you're hearing what's needed, and as you move forward in your career, there's a good chance that you'll be part of the solution in providing either the development, the facilitation, or the implementation of the programming, or perhaps as a researcher or program evaluator, you'll be assessing the benefits of our work. So thanks for listening. I just wanted to make sure that we all stayed on the same page in terms of content this semester, and it prepares you for uh, future assignments as well as discussions. Thanks, everybody.